Hi, occupational therapy students. My name is Stephanie Shane. I'm the founder of Pass OT, and I know many of you are struggling right now to take this test. Many students are struggling with finding the time to study, whether they have another job, they have family obligations, they're low on their finances. I want to let you know I'm here to help you put together a game plan, help you study smart, efficiently, and so you pass and have the most success. You can always send me a chat message or give me a call directly, and I can give you a customized plan on how to study. Right now, I'm going to help you get through this question in a simple way. So remember these 6 simple steps. So simply fill in the blanks or write it down on your whiteboard. And remember the mnemonic. Read with diligence and patience before answering. So remember, when you're looking at a question like this that has several sentences, we want to make sure we're reading the question carefully. Marty, a drywall carpenter, has been referred to OT for treatment of a repetitive stress injury caused by excessive ulnar wrist deviation and overuse of extensor pollicis brevis of his dominant upper extremity. When assessed, Marty was found to have a positive result for the Finkelstein Test, swelling on the radial side of his wrist and a pain level of 5 to 10. Marty's goal is to return to work in 4 weeks, which is possible if his affected hand is immobilized and his work modified. In order to support his goal of returning to work within this time frame, what will need to be incorporated into his intervention plan? So after reading this question, we want to get to step 2. Where is the question at in the OT process? So we are in the intervention stages. Step 3, disease or diagnosis. So what is this patient's disease or diagnosis? And is the disease progressive or non-progressive? So we know that it's repetitive stress injury caused by excessive ulnar wrist deviation and ulnar overuse of his extensor pollicis brevis dominant upper extremity, and it's not a progressive disease. So now we're at step 4. So what is this patient's problem? What is the patient's level of performance or function, and what symptoms are they experiencing, and what are their goals? So we know that it is a positive result for the Finkelstein's test, swelling on the radial side of his wrist and a pain level of 5 out of 10. Patient's goal is to return to work in 4 weeks. This is possible if his affected hand is immobilized and his work is modified. So now we are at step 5. What is in bold or in caps? So what is it saying next? What is the question specifically asking? If there are no bold or caps, what would you highlight as being essential to answering the question? So in order to support his goal of returning to work, what will be needed to incorporate into OT intervention plan? So now we are ready to look at the answer choices. And when we look at the answer choices, we want to make sure that the answer addressing the problem, question, and goals, and making sure that it's ethical, safe, patient-centered, occupation-based, and purposeful. So now let's read our answer choices. A hand-based splint in an anti-claw position and sensory re-education. B, long forearm-based radial gutter splint and training in ergonomics involving low force, low repetitions. C, long forearm-based radial gutter splint and training in ergonomics involving low force and reduced contact stress. D, functional wrist splint with wrist position and neutral and tendon gliding exercise. So let's figure out what our incorrect answers are. Well, we know A is incorrect because this is more likely the type of splint used and protocol followed for peripheral nerve injuries, such as a median nerve injury. B is incorrect because decreasing the rate of productivity would place undue hardship on the employer, requiring significant difficulty or loss of profit. D is incorrect because this splint does not include support of the thumb MCP. So the correct answer is C, long forearm-based radial gutter splint and ergonomic low force and reduced contact stress. The Finkelstein test is a classic provocative test for diagnosis of de Quervain's disease. De Quervain's disease is a painful wrist condition that affects the tendons on the radial side of the wrist. Symptoms include pain of tenosynovitis when moving the thumb, turning the wrist, grasping something, or making a fist. Pain may radiate to the thumb or forearm. Some people have swelling on the radial side of the wrist or difficulty holding objects. Marty is demonstrating the symptoms of Quervain's Tenosynovitis, which is characterized by pain and inflammation in the extensor tendon of the thumb or the first dorsal compartment. A radial gutter splint will support and immobilize the radial side of the forearm, wrist, and thumb MCP. Since repetitive stress is caused by high force, high repetitions, it would be best to train with lighter tools with less stress on grip than places the thumb in abduction and extension. So remember that in addition to the most extensive online course available, Pass OT prides itself on our passionate and dedicated tutors, each being an instrumental in helping our students pass the NBCOT exam through their one-on-one sessions. Have a great day, and we look forward to helping you pass the exam.